Good morning. My name is Jacob Mark. I am the medical director of the Pediatric Pancreas Center at Children's Hospital Colorado. I'm here with my colleague, Dr. Marco Del Chiaro, and we're going to speak a little bit about the Pediatric Pancreas Center here at Children's Colorado and answer some questions about the program.
Jacob, can you tell us a little bit about the Pancreas Center at University of Colorado Children's Hospital?
Absolutely. The Pediatric Pancreas Center, we really developed because we understand that children with pancreatic disorders require more than just one specialist to really take comprehensive care of them. So we developed a multidisciplinary team which includes pancreatic surgery, as well as pediatric GI, endocrinology, dietitians, pain specialists, and psychologists, really so that we can see the entire patient and take care of them for their whole needs from a pancreas perspective. As we do this, we partner with the Adult Pancreatic Surgery Program, which really helps us by giving us a way to transition our patients well once they become adults, as well as providing expertise in complicated pancreatic surgery. And our goal for this program really is to provide the best possible care for our patients with pediatric pancreatic disorders. And we strive to do that with our multidisciplinary approach, both by providing comprehensive medical care and cutting-edge endoscopic therapies with ERCP and endoscopic ultrasound. We did receive some recognition in 2020 by getting ranked number one in pediatric GI and GI surgery by the U.S. News and World Report. So we're very pleased about that, and we look forward to taking care of more of these patients. Margo, you're a very experienced adult pancreatic surgeon. Can you talk a little bit about what are the keys for success for good outcomes for pediatric pancreas surgery?
Yeah, I think actually this is a very important point, and our program, I believe, is very strong for this reason. Generally and historically, disease of the pancreas in children are very rare, so it's very difficult to find high-volume pediatric pancreatic surgeon. In the other hand, you have a very experienced and high-volume adult pancreatic surgeon that doesn't have experience in children. I think join together these two forces, so a very successful pancreatic pediatric program with a very high volume and successful adult pancreatic surgery program is really the way to go. Hey Jacob, can you update us a little bit regarding research at our Pediatric Pancreatic Center?
Yeah, we understand that the field of pediatric pancreatology really has a lot of room for improvement and need for research to help children, especially with recurrent and chronic pancreatitis. So we recently joined the INSPIRE Consortium, which is the only international research consortium on pediatric recurrent and chronic pancreatitis. And as part of this, we aim to improve the health of our current patients as well as improve the care for future patients with recurrent and chronic pancreatitis. In addition to this, we also have research studies going on within our institution, and we are partnering with a study looking at non-medication pain management strategies for children with severe pancreatic pain. Marco, can you talk a little bit about what are some things in our partnership between our program that really makes this unique so that we can provide the best outcomes we can for patients?
Absolutely. I think University of Colorado in general has a very strong pancreatic program. Last year we became one of the Center of Excellence for Pancreatic Cancer nominated by the National Pancreatic Foundation. And I think the model here we are proposing for pediatric patients is very similar to the model we have even for adults. Our, I think, peculiarity is that we discuss every single complex case in a dedicated multidisciplinary conference. I always say to my patient that I think 20 different brains sitting around the table and discussing by different disciplines, gastroenterology, oncology, surgery, pathology, radiology, about a single case are definitely better than one single person. So I think what we offer here to our patient is a multidisciplinary view, multidisciplinary approach that in my opinion is really the only way to get better outcome.
Thank you for joining us today. We are happy to see any patients with pediatric pancreatic disorders. You can refer patients to us by emailing us directly at pancreascenter@childrenscolorado.org, or you can visit us online through the Children's Hospital website, or you can search through Google Pancreas Center at Children's Hospital Colorado.